Hello friends, I'm Dr. Aarti Daswani and I want to thank Mala ma'am and Team Dental Reach for inviting me for sharing my learnings and my experience with the topic of case documentation and presentation. Looking forward to share with you all 10 tips and tricks that have helped me improving my documentation. So let's start. So why do we need to document? Documentation is essential for medico-legal purposes. It is a good tool for education of the fellow dentist, of our patients, and also for staff training. Good documentation helps in clear communication with our colleagues, with patients, and also for laboratory communication. When we have good records in the form of good photographs, we can come to a correct diagnosis and meticulously plan the treatment for our patients. Good documentation helps in monitoring of the conditions when we compare the preoperative pictures with the postoperative ones. Good documentation is essential for scientific publications and for the various accreditation exams. Lastly, good documentation helps us in evaluating our own work and thus helps in self-improvement. So once we analyze the case properly and come to a correct diagnosis, and we strive to do excellent work in our patient's mouth, at the same time, we document each and every step. And then if we are in a position to present it well, this is what is excellence in dentistry. And we can term it as 5-star dentistry. So let's work towards becoming a 5-star dentist. It is rightly said that success doesn't come from what you do occasionally, but it comes from what you do consistently. So we need to start somewhere. We need to come out of our comfort zones and start documenting our cases and keep on progressing because our patients deserve the best. So here I am today to enlist these 10 easy tips and tricks for case documentation and presentation which have helped me. I call them as golden rules. So the first golden rule is to know the purpose of your presentation. So my purpose of today's presentation is to simplify the topic, to share my learnings, and to inspire my fellow colleagues to start documenting. As we have all participated in the Activa Pronto Aesthetic Challenge, which is an amazing initiative by M&M Dental in support along with Dental Reach team, because they are celebrating the 25th anniversary. Really, lots of gratitude to Mala ma'am for such a amazing initiative for we dentist. So when we are presenting the present for the aesthetic challenge, let's define our purpose. So the purpose would be to study and understand this new material called the Activa Pronto by Pulp Dent, to use it for our patients meticulously, to make a note of the challenges that we face and to get to come to proper solutions to it, to follow a stepwise protocol and to document each and every step, to see the benefits of using it for our patients, and also to present it beautifully to the best of our ability for the challenge, so that we can showcase our work on bigger platforms, which will ultimately benefit the entire dental community. Golden rule number 2 is to know your patient. We must make a note of the case history, patient's chief complaint, and we need to just write a gist of it in our case presentation, whatever clinical findings that we note. Also, we must understand the etiology of a particular dental problem and make a correct diagnosis. For example, when we are restoring the class 5 cavity or the lesion, we need to identify the etiology, whether it is carious or non-carious cervical lesion, whether the cause is faulty brushing habit, trauma from occlusion, or some other cause. Accordingly, we can come and plan a holistic treatment plan for the patient. Because understand, see, it's not just about filling a cavity. It's about eradicating the cause that led to it. It's about restoring the lost tooth structure and maintaining the dental health of our patients in the long term. Golden rule 3 is know your materials. So whenever we use any dental material, we need to understand the rationale behind using it. Understand its chemistry, properties, mechanism of action. Also read the manufacturer's instructions for the exact technique of using it. And all the do's and the don'ts while using it. A case presentation must include the reason why you chose a particular material for the case and also any finer details that you would want to highlight. Another very important point is good isolation. Rubber dam isolation is a gold standard. We understand that bonded dentistry is more predictable under rubber dam isolation. Also, whenever you document, when you're not placing the rubber dam, still you need to isolate the area of interest. You may use a cotton rolls, cheek pads, keep the area dry, use high vacuum suction. Because in the photographs, if there is salivary contamination, if there are fluids, blood, the photograph will not look good at all. It should be a neat, clean, isolated, presentable picture. Also, in some cases, we can use other accessories such as retraction cord or paste. And in few cases, the Teflon tape comes to our rescue. Some cases use matrices for isolation. So whatever you use, the optimum isolation helps us to do neat work. It eases our documentation and results in excellent presentation. The fifth golden rule is always document the stepwise workflow. And before you start restoring the tooth, it's always very important to do the oral prophylaxis for our patient. Because if the photograph is showing calculus, gingival inflammation, bleeding, stains, and if you are presenting such photographs and restoring in such teeth, it is not at all presentable. It is, and it is not even, the longevity also gets compromised. So you do the oral prophylaxis, let the gingiva be healthy, and then you can perform restorative dentistry. Secondly, you must plan well for the case and follow a stepwise protocol. Whenever possible, take clear photographs of each and every step that you do. Now, once you are ready with all the photographs of the case, you must make it in a PowerPoint presentation form, and alongside of the photograph, put just a one-liner text. And in the presentation, you must include the immediate post-operative picture. And it would be a great idea if you could make a collage of the pre-operative and the post-operative picture to see the difference. The next golden rule is a recall and the follow-up. As we understand, the rubber dam isolation causes dehydration of the teeth. And also the very procedure of putting the rubber dam, removing it, and even the finishing and the polishing procedures, they may cause some trauma to the gingiva. So the immediate post-operative picture would be with the teeth dehydrated with traumatized gingiva, bleeding. So it's a good idea to wait for about 5 to 7 days for the rehydration of the teeth and for the healing of gingiva, and then take a recall photograph. Whenever possible, it is a very good idea to document 1 weekly follow-up, 1 month follow-up, 3 months follow-up, 6 months follow-up, 1 year follow-up, or whenever the patient returns back to you, take a picture, compare it with what you had done, compare it with the pre-operative picture, and you'll be able to determine the predictability and the longevity of the treatment that you do for your patients. Another very important aspect of dental documentation is dental photography. Always take consent from the patient for photography. Here you can see the template of the consent for dental photography that you need to get it signed from the patient. When you're using the full face pictures, block the identity of the patient. The DSLR camera is most recommended tool for dental photography, but there are many dental colleagues who are doing a brilliant job even with mobile dental photography. So whatever suits you, use it, but do document your cases. So whatever we use, either we use a DSLR camera or some other camera or the photograph or the mobile, we must understand that photo means light and graphy means to write. So light is the most important aspect for photography. In case of DSLR camera, the inbuilt pop-up flash may not be enough to give us a good pictures. So we need to invest in a ring flash or a twin flash. For mobile dental photography, there are these kind of selfie rings which are available. Also, Smile Light has come up with this very good device which is attached to the mobile, and it can be used for the mobile dental photography. Now, we must understand what comprises a good dental photography. So, these are a few parameters. If we take into consideration, it will help us in making really good photographs. So, these are focus, frame, plane, exposure, contrast, standardization, retraction. Let us see each of them in detail. Beginning with focus. So, a good photograph is a one which is a clear image in sharp focus. So here you can see few pictures. They are having clear focus of the area of interest that we intend to take. This is a smile picture, the smile view. This is a MIP view. This is the right lateral and the left lateral views of the patient smile. And this is the anterior aesthetic view, wherein, like, the six teeth from canine to canine are noticed. This is the view with the rubber dam isolation. So basically, whatever is our area of interest should be in focus. When we use a mobile dental photography, you just have to touch the screen and the area of interest comes under focus. You might have to move some back and forth to get the subject in focus. But remember to keep your hand stable, otherwise you'll get blurred images. As far as the DSLR photography is concerned, to get the images in sharp focus, we must adjust the camera. We always use the camera in the manual mode for dental photography. We need to do some settings. So to get sharp focus, we need to set our shutter speed to fraction of a second so that we eliminate the camera shake. The recommended value is 1/200. We need to set the aperture to a very small opening size to maximize the depth of field. The recommended value is f22 to f29. It is imperative that you use a macro lens for dental photography. Once you use a macro lens and you set the magnification ratio, depending on the photograph, like if you, when you're taking the smile picture, you set the magnification ratio of the macro lens to 1:3. When you're taking this anterior aesthetic view, you adjust it to 1:2. So once you have set the magnification ratio, you just need to move a bit back and forth till you get the image under focus. Only when you see through your eye, through the eye finder, the image is in focus, then only you click the button and capture the image. The second important aspect is framing of the image. Framing means you just need to show the area of interest and nothing else. Also, the tooth of interest should be in the center. If you see in this picture, preoperative picture, the tooth of interest is second premolar. The same applies to the intraoperative picture, wherein we can see the center tooth, which is a tooth of interest. I mean, even the postoperative image, we have the tooth in center. So basically, a good framing, you can see good framing is a one wherein, like, you just are able to see the subject of interest with little bit of front and back of it. You can see these consistently three teeth in all the three images. You need to click the images in such a way that you need to crop just 10-20%. But see to it that your frame does not include unnecessary number of teeth. Right. Now, the next important aspect of dental photography is the plane of the image. You need to maintain a straight plane. To maintain a straight plane, the camera should be held perpendicular to the area of interest. If not, a lot of time gets wasted to correct the tilted images by using the software for editing. So here, as you see, the image is taken where the plane was not perpendicular and we've got a tilted image. Now, once we straighten this image using editing software, we First of all, there's a lot of waste of time. Secondly, a little bit of details get eliminated. So it's always a good idea to take the first picture itself in the correct plane so that you need not edit it. Another very important aspect of photography is retraction. You must use these kind of transparent cheek retractors. Avoid using joint retractors because they're very difficult to manipulate. They're not of the correct size and they cause trauma to the patient as well. So these come very handy, the transparent cheek retractors. Avoid using colorful retractors. Because see in the picture, this MIP picture, we have used the transparent cheek retractor. At the corner, you can see a bit of the retractor. Now, had I used a colorful one, there would have been a lot of distraction in the image by the color of the retractor. So always use transparent cheek retractors. Retract outwards and upwards for the upper arch, outwards and downwards for the lower arch, in such a way that you can see the vestibule. So this is a good retracted picture wherein you can see the interdental papilla, the free gingiva, the attached gingiva, and up to the vestibule. These are the half retractors which are utilized for the quadrant dentistry. Next important aspect of dental photography is exposure. The photographs should be well exposed. It should not be very dark. It should not be very bright. Another very important aspect of good photographs is a contrast. The purpose of the contrast is to make the subject stand out. Now here, to make the subject stand out, we use a contrasters like black contrasters, or we can use a rubber dam. So here you can see the black contraster was placed palatally for the anterior aesthetic view, where the subject of interest was from canine to canine. And the contraster makes the subject of interest very prominent. In this case, the contraster was used lingually for the 3 teeth of interest. Now imagine if we had not used a black contraster here, we would have been able to see the tongue, the floor of the mouth, the teeth on the other side and whatnot. It causes a lot of distraction. So if you want clear-cut focus pictures in the frame, we just need to have the subject of interest. So the contraster helps us in that. In the same case, when we use a rubber dam, it covers all the other areas so that we get the subject of interest in focus. Next very important aspect of dental photography is the standardization of images. It means that a series of images need to look identical and uniform in composition. To get the standardized images, you must crop uniformly. You must use uniform angle of shooting, the uniform lighting, and the DSLR camera manual mode when we use a uniform f number and the same magnification ratio for both the preoperative, intraoperative, and the postoperative pictures, we tend to get the standardized images. See here, if you see in the frame, it starts from central incisor of the left side, it ends with the second premolar. Similarly, in the postoperative picture, we have the central incisor and the second premolar. The brightness, the contrast, the lighting, almost everything looks identical in both the preoperative and the postoperative images. This is what is called as standardization. This is a very good case pic courtesy of Dr. Preeti Lamba, wherein you see the images are so well standardized. You can see uniform composition of all the images. You can see the similar number of teeth in all the images. 3 to 4 teeth are visible in all the images. So we must aim to get standardized images which helps in getting clarity. Otherwise, it just confuses the viewer, and we just need to keep in focus what we want to show. Now, standardization images is possible with a macro lens 100 millimeters because the distance between the subject and the camera gets fixed when you use a macro lens. The 8th golden rule is the editing of the images. I would suggest click the images in such a way that you don't need to do much of editing. Still, if you feel the need of editing, you may use an editing software such as Adobe Photoshop, Microsoft Photo Editor, Picasa, etc. Especially when you are giving the accreditation exams, a lot of editing is not allowed. Minimal edits are allowed, which could be altering the brightness and the contrast of the entire image, just the cropping of the image, and rotating the image. The 9th golden rule is be neat, organized, and make a self-explanatory presentation. Be neat in your work, be neat in the way you document, be neat in the way you present. When you make it neat, organized, it becomes a very crisp presentation. Avoid too much of unnecessary details. The presentation should be very precise and self explanatory, in such a way that even in the absence of the presenter, the presentation itself serves as a teacher. It creates a great learning experience for the viewer. A 10th golden rule is to use your creativity. There is no limit to which you can use your creativity while making the case presentations. You may use colors, you may use the color contrast, insert images, insert audios, videos. You may even use the art of storytelling when you put the text alongside the photographs for your case presentation. When you are presenting the case before a live audience, you can make it interactive by asking questions, by putting up polls, or by starting some discussions. You may use some inspiring quotes which can motivate the viewer. At times, you may even incorporate humor in your presentation. But be aware of the purpose and the context of presentation. So when we are making presentation for accreditation exam or for publications, remember most of these points will not be applicable. But of course, when you are making the presentation for educational purposes, for sharing on social media, for just sharing with our colleagues and even showing it to our patients, we can include most of these points and make a presentation very, very creative and very engaging and interesting. So here I would like to say that I consider myself as a slow learner. And because I have not been documenting a lot, I just started documentation a few years back, but very selectively, very few cases I document very slowly and gradually. And day by day, I am improving. So if I can do it, I must say that even you can do it. I hope this presentation has inspired the ones who have not yet started documenting to start documenting their cases, and also has given some idea to the people regarding what we must include in our presentations. I once again thank Ms. Mala ma'am and Team Dental Reach for giving me this opportunity to share. Thank you.